Good morning, this is Dr. Mary Bates, and this is not personal medical advice, nor is this the opinion of my employers. This is also not some kind of fancy obscuration screen. This is fog. The lake is warm, the air is cold, and steam comes off the lake. It'll happen for a couple days in the fall, a couple days in the spring, as the temperature is variable, and it's just super cool. I'm glad I get to share it with you. Last video I did, I neglected to mention something important, or maybe it was 2 videos ago. I neglected to mention something important. When I'm thinking about a patient's mentation, one of the things that I do is to check a urinalysis, because sometimes in older folks, the only symptom of a urinary tract infection, a UTI, can be that their mentation is off. Just sort of interesting. In younger people, whoo boy, you get lots and lots and lots of symptoms. But in older people, sometimes you don't. Interesting, huh? So also, if you're wondering about if you're wondering about your loved one's mentation, that is another thing that their doctor will want to do. So today's topic is, we're going to, I have notes because I don't want to make a mistake like that again. Today's topic is we're going to talk about how to let your loved one's doctor know that you have concerns about your loved one's memory. Sometimes, the family is the first to notice, not always, but sometimes the family is the first to notice, or sometimes the doctor has noticed and has not been able to notify the family, or feels it's not a point that the family needs notifying, or doesn't know the family, or whatever. Good morning, ducks. I wonder what that was about. Anyway, so probably if you know who your mother's physician, or if you know who your mother's physician or nurse practitioner, their primary or physician's assistant, their primary care provider is, probably the easiest way for everyone is for you to just write a letter. Dear Mary, I just wanted to let you know that I have some concerns about my mom's memory. Here are the reasons why. Here is what I'm hoping you will do about it. Maybe you could do some formal testing, or, the usual labs. Obviously be respectful, because, these are people who have a lot of training, but you also have something to bring to the table. You see your loved one in their own environment, and you know them obviously way better than their physician does, regardless of how long they've known their physician. You still see them more. So those are so that's the first thing you can do, just send a letter. You can call, again, if you know who your loved one's physician is, you can call. I have heard recently people saying, oh, we cannot confirm or deny if that person is a patient here or not. I learned in med school that you can confirm or deny if someone is a patient, but you are not allowed to give out any medical information, of course. So, that might not get you anywhere. And the problem with that, of course, is that people in doctors' offices are so busy these days that, if you call and they'll be like, well, this isn't really, an emergency, so we'll call you back. And then you're playing phone tag and you're asking, but it's, it is important. Like, the whole point of doctors' offices is to provide patient care. So it's important, but on the other hand, a letter might just be better. It's kind of like the old song, I can send you a telegram, I can write you a letter, I can call. The other thing you can do is, if your loved one will let you, of course, going with them to an appointment is super, super valuable. Even if you don't want to be the one to say, don't want to say in front of the doctor, I have concerns about my mother's mentation, you can actually, while your mom has stepped up on the scale, you can tap the medical assistant on the shoulder and hand her a note that says, I have concerns about my mother's mentation. I'm worried about my mother's memory. And that that can be really helpful. So the the usual step when when that happens, the usual first step is to do some kind of quick mental memory test. The old standard was the mini mental status exam. The people who developed that are now enforcing their intellectual copyright or their intellectual property and enforcing the copyright, and you have to pay in order to use it. So so no one's using it anymore. So instead, there are other tests to use. There's the MOCA, RUDAS, SLUMS. They ask questions like, they give you 5 things to remember, and then they distract you by asking you some subtraction questions, and not distract you, but test other things, and then they come back and say, how about them 5 things, Mrs. Jones? And it's funny, whenever I do this test with people, I can tell that their loved one in the room is also doing the test themselves. So it's a very, so we do that. We ask you to say some numbers backwards. We'll probably ask you to draw a clock, identify a camel, or say the names of some animals. I always enjoy that. That's my favorite part of the test, is how many animals can you name in a minute? And you just set the person free, and it's interesting because you can kind of see how their mind is working. I had a patient one time whose husband was in denial about her memory loss, and he had her practice naming animals. He taught her strategies to name more animals, as though if she scored higher on the memory test, her memory would improve. Very sweet, very heartbreaking. Also kind of funny. I mean, and I don't mean to be making light of this, of course, because this is such serious and tender stuff. But it's also so important, because if your loved one is having some memory loss and you are caught unawares, sometimes they can have car accidents. They can even kill someone else in a car accident. They can set their house on fire. They can injure themselves. They can, it's really not something you want to put your head in the sand about. Although I totally understand that this is very tender stuff, and that I understand completely why people would want to be in denial about it. Let me tell you, I get it. I totally get it. And yet, it's important not to. As I just said, the big safety issues to think about right away are driving. We'll talk more about driving in the future. I often tell people, even when they are thinking, especially when they are thinking really well, please consider getting yourself on a list for an assisted living, especially if they live by themselves, and their children live an hour away and they can't move in with their children when things get worse. Please consider getting yourself on a list for an assisted living, because otherwise you're going to end up in the hospital at some point, and then you're just going to have to go wherever the hospital tells you, wherever you get sent. Whereas if you get to the top of the waiting list, because there is a waiting list for these things, you get to the top of the waiting list, you don't want to go today, you say, okay, put me back down on the waiting list and call me next time I come to the top. And that's totally fine to do. Depending on the assisted living, there is so incredibly much paperwork you have to do in order to get going on it. It can take a long time. So, as soon as you think I might need an assisted living, it's time to start working on getting yourself on a waiting list. The other thing to think about, this is, boy, today another day where I'm a real downer. The other thing that people don't talk about this enough, I think, is that the rate of suicide among elderly people, especially elderly men who are vets, especially elderly men who are vets and have guns in the house, is very high. So if your loved ones fall into these categories and are starting to have some memory loss, please talk with them about it. I do try to talk with my patients about this as well, but there are only so many hours in the day, only so many minutes in a visit, only so many visits per year, etc. So that's another serious thing that families need to chat with their loved ones about. All right, maybe tomorrow I'll be able to be more cheerful, huh? I don't know. All right, thank you for listening. I mean, we do this stuff because we love our loved ones. I guess that's the cheerfulness, is we love them, and we're trying to make their final years as good as possible. And people with dementia, their lives can be filled with joy and happiness and love and mosquitoes. Their lives can be filled with joy and happiness and love and meaning, and we want to give them the maximum chance at this. All right. Thank you so much for joining me this morning.